Bolton is quite a large district general hospital, but we're not just a hospital, we also cover the community services. I remember when I came here first, I was overwhelmed just by the friendliness of people. When people do start for the first time, they're given a really warm welcome and they're actively encouraged to become part of the teams very quickly. Over the past 20 years, there's been lots of changes to the nursing role, lots of advanced practice, but fundamentally the nursing role remains the same. It's about people who want to be kind and caring and compassionate, and that's the basis of what we're looking for our nurses coming in. Our nursing strategy is based around the 6 C's, and the strapline that we put to that is about unlocking people's potential, supporting, encouraging and empowering people to do the right thing for patients.
All new nurses that start into the Trust have a comprehensive preceptorship programme. We like to nurture our talent, so we offer career advice. We also offer a rotational programme for staff that are interested in getting a variety of experience across hospital and community setting. We've just attained gold standard across the whole of the hospital for our learning environments. The opportunities are there for all individuals who are keen to progress in Bolton.
Our responsibility is one-to-one nursing, so it's the care of that patient throughout the shift. It's very hands-on. I don't come from a nursing background, didn't really know whether I wanted to be a nurse. Started off as housekeeper, saw what the girls did on here, really thought this is where I want to be. Went off to university with the full support of the management and the team. To be able to care for these people that are in such a vulnerable position, just look after them and their families when they're with them, it's just an absolute privilege. We've recently won an award, Best Critical Care Unit in the Greater Manchester area, and that's for our safety culture, so we're really proud of that. It comes back to that teamwork and the communication, for just the friendliness of the place, to somewhere you'd actually want to work and somewhere you wouldn't mind going being looked after.
We have a lot of emergency situations that can arise on coronary care where we need to act very quickly. Leaders are identified right at the beginning of the shift of who will take lead in those situations. Teamwork is imperative. I do believe there's some extremely good teams within this hospital and they work very well. We communicate with patients and families on a daily basis. It's important that we ensure that they're aware of each step of their journey within the hospital. There can be certain issues, obviously, when patients are extremely unwell, that you have to have those difficult conversations with the family. The fact that they're aware of everything helps them to sometimes accept the diagnosis a little bit easier.
As a district nurse, you're a guest in the patient's own home. They allow you in to provide that care for them. When you're with a patient on a one-to-one basis, you've got that trust and that building that relationship, and then they'll confide in you, and if there's something that they're concerned about normally, they will tell you, and then you can act on it and safeguard your patient that way. I would certainly encourage nurses to come and work for Bolton, and especially in the community. It makes me feel like I've done something good for somebody else and made a difference to their life and improved and enhanced their life.
I look after children that come in with numerous problems, whether it be medical, surgical, and those that are quite poorly that need high dependency. nursing sick children was what I wanted to do, and that's what I did from leaving school. I did a placement here. I knew that I wanted to work here when I qualified. It's such a nice place to work. Everyone's bubbly, cheerful, so smiley. It can be hard, it can be very stressful, but it's very rewarding at the same time because you see that child coming in sick and then you see them better and you've contributed towards that.
When you have the opportunity to be on delivery suite or the birth suite and you bring a new life into the world, it's absolutely incredible. There's nothing like it, and I don't see it as it's just a baby being born and it's a new life starting. It's a whole new family. It can at times be very difficult, but there is excellent support here. We have supervisors of midwives to support staff through any difficult experiences that they may be having. What the staff room sees is, a really good, supportive, nurturing environment, and you do tend to leave your shift feeling nurtured and looked after.
It's really important that you're a role model, being a ward manager. Over the years, I've nurtured lots of student nurses to become staff nurses, to then become in senior positions, so it's really important that people do see you as a positive example. I've been a patient here, I've had babies here, and I've had family members who've been a patient here, and it's really important to me that I treat my patients how I'd want to be treated. My colleagues are lovely, we all get on really well, we're like a family. It's really important that that culture exists at Bolton because you want to do your best in your job, and if you don't like your job then you can't deliver a high service to your patients.
So many opportunities at Bolton in terms of development, and what we're really conscious about is that everybody's at different stages and everybody wants to develop at different stages in the career. We can offer so many speciality placements, and also being an integrated care organisation, we've got that unique opportunity that our nursing staff can work both in a hospital setting but also gain experience in the community setting. The most important thing that a nurse needs to feel is that they're in the right environment that's right for them, that encourages them to learn and to grow. I really believe that Bolton offers nurses coming through the doors the potential to be the best they can be.